Welcome to the deep dive. So, if you're a fan of those wonderful larger dog breeds, you might have heard these terms thrown around: canine osteochondrosis (OC) and osteochondritis dissecans (OCD).
hmm
They sound pretty complex, and honestly, they can be a real issue for our dogs.
They definitely can be.
So today, in this deep dive, we're going to try and unpack what these conditions really are. How they start, which breeds are more likely to get them, how vets spot them, and really importantly, what we can actually do about it.
Exactly. And it's really key, I think, to remember that while OC and OCD are, well, fairly common, especially in those bigger dogs, just getting a good handle on the basics can really empower you as an owner.
Right, helps you be more proactive, maybe spot signs early.
Yeah, and have better conversations with your vet. We're drawing all this from, solid veterinary sources and expertise on these conditions.
Okay, let's jump right in then. Osteochondrosis, or OC. At its core, what is the fundamental problem there?
Well, OC is essentially a problem that happens when a puppy's cartilage is growing. Specifically, it messes with this really crucial process called endochondral ossification.
Okay, sounds technical.
Haha. Yeah, it just means the normal way cartilage gets replaced by bone as a young dog grows up. With OC, that process, it just doesn't go quite right. The cartilage doesn't turn into bone properly, and you end up with, well, too much cartilage left behind.
Like, imagine a construction crew. Maybe having trouble laying the foundation correctly.
That's a great analogy, actually. Yeah, the base, the bone underneath, just isn't forming the way it's supposed to.
So the bone structure isn't solidifying right under the cartilage. What's the first sort of hiccup that causes this?
The main issue is that the cells, the ones in the immature joint cartilage and the growth plates, they just aren't maturing or developing normally. And if we look really closely at the articular cartilage,
Yeah.
that's the smooth stuff covering the bone, ends in a joint.
Hmm.
Often it's a problem with the local blood supply being disrupted.
Ah, blood supply.
Yeah, that lack of good blood flow stops the bone formation that should be happening underneath. Now, here's where it gets interesting. If the blood supply comes back, sometimes it can heal.
Okay, that's good.
But if it doesn't, then the cartilage can keep getting thicker, and eventually it might even start to separate from the bone beneath it.
Wow. So OC is like this mismatch or developmental glitch between the cartilage and the bone. So then how does osteochondritis dissecans OCD fit into this picture? Sounds like maybe a later stage.
You got it. OCD basically develops from that initial OC problem. What happens is a crack of fissure forms in that thickened cartilage area.
Okay.
This crack lets the joint fluid, the synovial fluid that's normally in there, seep in between the cartilage and the bone. And over time, that fluid getting in there leads to a flap of cartilage forming, which eventually just breaks loose, detaches completely.
And those detached pieces, are those the joint mice I've heard about?
That's them. Yeah, joint mice, little bits of cartilage floating around in the joint. Not ideal, obviously.
No kidding. Joint mice, very descriptive, maybe a little creepy. So it sounds like a dog could have OC, the underlying issue, and we might not even know it.
That's a really, really important point. Yes. OC can often be silent, no obvious signs at all. Your dog might seem perfectly fine.
But when that flap detaches, when it becomes OCD, that's when the problems really start showing up.
Exactly. The lameness, the pain that usually becomes noticeable once OCD develops, and that flap starts irritating things inside the joint.
That makes total sense. Now, you mentioned certain joints get hit more often. Where specifically in the body do we usually see OC and OCD?
The big ones, the most common joints are definitely the shoulder,
Okay.
specifically the back and center part of the humerus, the upper arm bone. Then the elbow, usually the inner side of the lower end of that same bone.
Elbow, got it.
The stifle, which is the knee joint, it's typically the lower end of the femur, the thigh bone, and more often the outer part, the lateral condyle.
Okay, stifle.
And the hock, the ankle. Specifically the top ridge of the talus, the ankle bone, usually on the inner side there.
Shoulder, elbow, stifle, hock. Those are the main players.
Those are the main four, yes.
Are there other, maybe less common spots where this can happen?
Oh, absolutely. While those four are the most frequent, it's not limited to them. We can also see it less commonly in places like the hip joint, both the top of the thigh bone and the rim of the socket. Even the shoulder socket itself, the kneecap, the lower end of the radius and ulna in the forearm, the inner ankle bone,
Wow.
and even parts of the spine. The front end of the sacrum, the spinal joints, neck vertebrae. It just shows that while it favors those big weight-bearing limb joints, It can technically affect cartilage almost anywhere.
So it really can be quite widespread. Okay, let's dig into the why.
Mm.
What are the main causes, the risk factors that make a dog more likely to get these conditions?
Well, genetics. Genetics plays a really big part.
Figured that might be the case.
Yeah, it's thought to be polygenetic, which just means it's not one single gene causing it, but a whole bunch of genes interacting, plus, environmental factors too.
So complex.
Very complex. It's like height in people, right? Not one gene, but many working together. It's similar here. There's actually something called a heritability index,
Okay.
which kind of gives us an idea of how much genetics contributes. It can range maybe 0.25 to 0.45 depending on the breed. So maybe around 30% or so of the risk is genetic, the rest is environment, diet, things like that.
So genes load the gun, maybe environment pulls the trigger.
That's a decent way to think about it, yeah. While genes are definitely important, other factors like maybe how fast they grow or what they eat also really matter.
And we always hear about certain breeds being more prone. Which ones are we talking about? The big guys.
The big guys, exactly. Large and giant breeds are definitely significantly more predisposed. Breeds that pop up again and again in studies include Great Danes, Labs.
Oh, labs too.
Yeah,
Okay.
yep. Labrador Retrievers, Newfoundlands, Rottweilers, Bernese Mountain Dogs, English Setters, Old English Sheepdogs. So if you have one of those breeds, it's certainly something to keep in the back of your mind.
That's a really useful list, especially for anyone listening who owns one of those lovable giants. Now, timing-wise, when do these problems usually start to show up? Is there a typical age?
Yeah, the clinical signs, the lameness or pain the owner notices, that typically starts between 4 and 8 months of age. That's the common window.
Okay, pretty young.
Very young. Diagnosis often happens shortly after, generally between 4 and 18 months old. Of course, if they develop secondary arthritis later on because of it, symptoms from that could pop up at any age.
And besides the genetics, are there other things, maybe nutritional or developmental factors, that can push a puppy towards OC or OCD?
Yes, definitely. There's evidence pointing towards nutrition and growth rate. For instance, diets that are way too high in calcium,
How high is too high?
like maybe 3 times the recommended levels, that's been linked as a risk factor. Also, just really rapid growth and putting on too much weight too quickly during puppyhood, often from overfeeding, seems to increase the risk as well.
So managing that growth phase carefully, especially in those at-risk breeds, sounds really crucial.
It absolutely is. Slow and steady growth is generally better.
Okay, let's talk about what owners might actually see. What are the key signs, the symptoms that could point towards OC or OCD?
Right, so the signs you'd see really depend on which joint is involved and also if there's already some secondary joint degeneration, some arthritis starting.
Makes sense.
But the number one most common sign, by far, is lameness, a limp.
Okay, just a general limp.
It can vary a lot. It might start suddenly or it might creep up gradually. Could affect just one leg or sometimes more than one. Often it seems worse after the dog's been exercising.
Worse after exercise.
Yeah, that's pretty typical. And the severity can be all over the map too, from just a tiny subtle limp you barely notice to the dog really struggling to put weight on the leg.
And if a vet suspects this, what might they find during the physical exam?
During the hands-on exam, the vet can usually pinpoint pain when they carefully move the affected joint, flexing it, extending it, rotating it.
Okay.
There's usually that noticeable weight-bearing lameness we talked about. If it's progressed to OCD, especially in the elbow, stifle, or hock, the vet might actually feel some swelling or extra fluid in the joint.
Like puffiness.
Exactly, some joint effusion. And if the lameness has been going on for a while, you might start to see muscle loss, muscle atrophy around that joint because they're not using it as much.
Right, makes sense.
Oh, and one specific thing for hock OCD, sometimes you see hyperextension, where the ankle joint extends further back than it normally should.
Okay, so lameness, pain when moving the joint, maybe some swelling or muscle loss. Those are the main clues.
Yeah.
How do vets actually confirm the diagnosis? Get that definitive answer.
It's usually a combo platter. Starts with that thorough physical exam, and then imaging is key. X-rays, radiography are almost always the first step.
What can x-rays show?
They can show changes in the bone right underneath the cartilage. Like maybe the normal smooth curve of the bone looks flattened, or there's an area that looks less dense, kind of washed out. We call that radiolucency.
Okay.
But here's the thing. Standard X-rays often can't definitively tell you if it's just OC or if it's actually OCD with a flap, unless that flap has started to calcify, to harden up with calcium, making it visible.
So x-rays give clues, but maybe not the full picture always.
Exactly. You often need special angled views or compared to the other limb. Seeing those little joint mice fragments on an X-ray is a pretty strong sign of OCD, though.
Right. So what if the x-rays aren't totally clear? Are there more advanced options?
Oh, yes. More advanced imaging like CT scans and MRI can be really helpful to give a much better look at the bone detail and the extent of any lesions under the cartilage.
Which is better, CT or MRI?
MRI is generally considered the most accurate for actually seeing the cartilage itself, detecting those OC or OCD lesions, and spotting any flaps or fragments floating around. It gives the best soft tissue detail.
Okay, MRI is a top tier then.
Pretty much for visualizing the cartilage, yes. Ultrasound can sometimes be used too, but its accuracy really depends on the person doing it, and it's generally seen as less reliable for this. There's also something called contrast arthrography, injecting dye into the joint, which can be useful sometimes, especially for shoulder OCD.
So quite a few imaging tools in the toolbox. What about like actually looking inside the joint?
Good point. A joint tap is one thing, taking a small fluid sample from the joint.
What does that tell you?
It can confirm there's inflammation or something going on in the joint. With OCD, the fluid might look okay, maybe slightly less thick, and under the microscope you see certain types of inflammatory cells. But these findings aren't unique just to osteochondrosis. Other things can cause similar changes.
So it confirms joint trouble, but not necessarily what trouble.
Precisely. Which leads us to arthroscopy. It's minimally invasive surgery using a tiny camera.
Ah, the scope.
Exactly. And it's fantastic because the vet can directly see inside the joint. It's excellent for telling OC from OCD, seeing the flap if it's there, and often they can actually treat it right then and there during the same procedure.
Wow, so diagnosis and treatment rolled into one sometime.
Often, yes, it's a really valuable tool.
Okay, that makes sense. So let's shift to treatment then. Once you have that diagnosis, OC or OCD, what are the options?
Well, it depends a bit. If it's just OC of the joint cartilage, meaning no flap has formed yet, the initial approach is often non-surgical.
Like what?
Usually involves rest, maybe strict rest for a bit, pain management with meds, sometimes physical therapy. But it's really important to know that OC can progress to OCD as the dog grows.
Right, it might not stay just OC.
Exactly. So once OCD is developed and you do have that cartilage flap, then surgery is generally the recommended way forward. The goal is to remove that flap.
How do they do the surgery?
It can be done either through a traditional open joint surgery, making a larger incision, or, more commonly now, through arthroscopy, using that camera and small instruments. It's much less invasive.
Less invasive sounds better.
Generally, yeah. There's also a more complex surgery for some joints, like shoulder, elbow, stifle, called an osteochondral autograft. That's fancy.
It does.
It basically means transplanting healthy cartilage and bone from a non-weight-bearing area to the damaged spot. But research is still ongoing to see if the extra benefit always justifies the more complex procedure compared to just removing the flap.
Okay, so flap removal is the main goal, usually arthroscopically if possible. Are the recommendations the same no matter which joint is affected?
Mostly, but there are some slight differences or considerations. For the shoulder, surgery is pretty much always recommended for OCD. Even if it just looks like OC on x-rays, but the dog is lame and painful, they might recommend exploratory surgery.
Okay, what about the elbow?
Elbow, also generally recommended for all OCD. And doing surgery there also lets the vet check for other common elbow problems, like fragmented coronoid process, which often happen alongside OCD.
Ah, okay. Stifle, the knee?
The stifle is a bit more controversial, maybe. Surgery is often done to remove the flap, but unfortunately dogs often still develop significant arthritis in the knee later on, even after surgery.
Oh, really?
Yeah, but arthroscopic surgery might still help them recover faster and maybe have better long-term function in some cases. It's a discussion to have with the surgeon.
Right, and the hock, the ankle.
Hock surgery aims to remove the flap, but again, the long-term outlook is often considered a bit guarded because arthritis tends to regress there pretty significantly regardless.
So even with surgery, arthritis is likely?
Often, yes, especially in the stifle and hock. In really severe hock cases, sometimes joint fusion arthrodesis is considered as a last resort, a salvage procedure.
Wow, and the sacrum, if it happens there.
If there's an OCD fragment in the sacrum pressing on nerves, then surgery to remove that fragment is definitely recommended to relieve the pressure.
Makes sense. What about managing the pain and inflammation, especially if surgery isn't right away or during recovery?
Yeah, non-surgical management is super important for comfort. This usually means using anti-inflammatory drugs, NSAIDs, like carprofen or meloxicam, and maybe other pain relievers.
Do those help heal it?
That's the crucial thing. No, they help with the pain, the inflammation, make the dog feel better, but they don't heal the cartilage defect or make the flap go away. Surgery is still usually needed for the underlying OCD.
Got it. So meds help symptoms, surgery fixes the mechanical problem?
Exactly. And long-term use of corticosteroids like prednisone is generally avoided because of side effects and potential harm to cartilage.
What about supplements like glucosamine?
Yeah, chondroprotective agents, glucosamine, chondroitin sulfate,
Mm.
they might be helpful. The evidence is debated, but they could potentially help limit further cartilage damage and might contribute to managing pain as part of a broader plan. Doesn't hurt to try, usually.
Okay. And after surgery, what's recovery like?
Post-op care is key. It usually involves cold packing, cryotherapy on the joint right after surgery to reduce swelling. Gentle range of motion exercises are typically started pretty soon, as soon as the dog is comfortable.
Keep it moving, but gently.
Right. And then activity has to be really restricted for about 4 to 6 weeks. No running, jumping, hard surfaces, leash walks only, short ones,
Strict rest.
very strict. And all through recovery and really for the rest of their life, keeping them at a lean, healthy body weight is absolutely critical. It reduces stress on the joints.
Weight control is huge.
Huge.
So it's quite a process, surgery, meds, careful recovery. What's the long-term outlook usually? What can people expect down the road?
It really varies by joint and how bad it was to start with. For the shoulder, the prognosis after surgery is generally good to excellent. Most dogs get back to near normal function with minimal arthritis long term.
That's encouraging for shoulder cases.
It is. But for the elbow, stifle, and hock,
Ah,
the prognosis is often more guarded, especially with OCD.
guarded meaning.
Meaning progressive osteoarthritis is pretty common even after surgery. Long-term comfort and function depend on how big the lesion was, how much arthritis was already there, the dog's age, lots of factors. They might need ongoing management for arthritis.
So those joints are just trickier long-term.
They tend to be, yes. For the sacrum, if they remove a fragment causing nerve issues, the prognosis for neurological recovery is generally good.
Okay. And what about trying to prevent this in the first place? Can anything be done?
Well, given that big genetic component we talked about,
Right.
a major preventative step is responsible breeding. Discouraging breeding of dogs known to be affected, and definitely avoiding repeating a breeding pair that has produced affected puppies.
That makes sense for breeders. What about owners?
For owners, especially of those high-risk breeds, managing growth is key. Careful diet, avoiding overfeeding, aiming for that slow, restricted, but still healthy weight gain during puppyhood. That might help lower the chances of it developing or being severe.
Control the controllables like diet and growth rate.
Exactly. And regular yearly vet checkups are always a good idea anyway. But they can also help monitor for any early signs of joint issues or track the progression of arthritis if it does develop, allowing for earlier management.
So just to kind of wrap up our deep dive here, canine OC and OCD are these developmental joint problems heavily influenced by genetics, hitting those larger breeds hardest. Spotting it early, looking for lameness, getting a good vet exam, using imaging, and then getting the right management, which often means surgery for OCD, is just so crucial for the dog's comfort and staying mobile long term.
Absolutely. Being aware of the signs, especially if you own a predisposed breed, and talking to your vet right away if you're concerned, those are the most important things you can do as an owner.
This has been super insightful, really clarifying these tricky conditions. And it really drives home how important that proactive, informed care is. So, on that note, maybe a final thought for everyone listening. We know there's this strong genetic link, and we know rapid growth plays a big role. So, what are the sort of bigger picture considerations for breeders and even for owners choosing large breed dogs when it comes to making decisions that could actually help reduce how often we see OC and OCD, or maybe how severe it gets in future generations? Definitely some food for thought there. Thanks for joining us for this deep dive.